Hello, and thank you for joining us today for our webinar, Unheard Voices in the Childcare Debate. My name is Andrea Mrozek, and I'm a Senior Fellow at Cardus, and I will be moderating our conversation today. As people continue to log on, I'm just going to get started by telling you a little bit about Cardus and what is actually a series. We are going to be talking about unheard voices, not just today, but for a couple of sessions in the future in October. First, about Cardus. Cardus is an independent, faith-based think tank that strives to establish policy for the common good in 4 key areas: economics, religious freedom, education, and family. And we have offices in Hamilton and Ontario, Ottawa, Ontario. My colleagues and I have examined the issue of childcare for about 15 years. Our working definition, which is important, I think, to get up there at the start of this, is that childcare is the care of a child, no matter who does it. And we feel that this definition best reflects the diversity of care options that Canadians are using, which may range from licensed to unlicensed care, from private to not-for-profit, from home daycares to centers to nannies, babysitters, extended family, and parents. So last but not least, never forget the parents. We place parents at the heart of our consideration of childcare, understanding that parents are going to make varying decisions about childcare over the course of needing to use it, sometimes changing year to year or from child to child. We were discussing this recently with colleagues and realized that among us, we had all used every possible last form of childcare, and that was often within one family. So I personally remember reporting on this issue first as a journalist, going way back. This is way back when the time had come back in 2004 for a truly national system of early learning and childcare. From journalism, I moved on to do work in the think tank environment. And so most recently, we have done a lot of work on childcare. We have convened roundtables to hear from a diversity of voices. In 2019, we did a positive vision for childcare that brought together parents, providers, professors, think tankers, and decision makers, all of us around the table really gathering around the vision that national daycare will not be delivered as promised, is not the solution that it's presented as. So we established better principles for workable childcare in that paper, and we carried forward with those roundtables and continued to listen as COVID hit. We've done polling with the Angus Reid Institute, and most recently, a big effort was put into Look Before You Leap, the real costs and complexities of national daycare. And this is today the most thorough and up-to-date cost assessment of national daycare. So what that reveals, unsurprisingly to many, is that the costs of national daycare will be much higher than what the federal government has currently allocated and than what we are being told. So our reasonable cost model rang in at $36.3 billion annually, and we believe that will leave the provinces to fill in the gap when funding shortfalls arise. All of this work on childcare over such a long period of time has led us to realize that there are many diverse voices that are not being heard as we consider childcare policy. The space for hearing a diversity of legitimate views on this issue has really diminished over the years that I've been working on this issue. So we are starting today with rectifying this situation. Please mark your calendars. As I mentioned, this is a series. On October 13th, we are going to be talking with Helen Ward of Kids First Parenting Association, who will bring a parent view and also her own longstanding history studying and researching childcare. That'll be at 2:30 Eastern Standard Time. And then we will talk more broadly about the care economy with Bev Smith, the creator of equalityandcaregiving.org, on October 19th, also at 2:30 Eastern. So those are 2 upcoming events, plenty of unheard voices. I feel like we could do this going forward in the future for a while. One housekeeping item, throughout our discussion today. If you are watching and listening and have a question, then please feel free to leave it in the Q&A function, and I will try to get to as many of those as we can before we conclude. Today's session is 1 hour, and we do aim to conclude on time at 2:30. So without further ado, I am going to one by one introduce our panelists on today's discussion. We are very pleased to be joined by these three panelists, each with their own unique views of childcare, particularly in Ontario. I will begin by introducing Karen Renkema. Karen is the Vice President for Ontario at the Progressive Contractors Association of Canada. This is an employer association representing members in the construction industry. I hope I got that right. Karen, can you just tell us a little bit more about your organization and your work?
Well, let me start out with just first introducing myself. I am a mom first, will always be a mom first of a 9-year-old and a 4-year-old, but have taken great interest in this issue, both personally and professionally. I've been working in the construction industry, mostly as a lobbyist and advocate within the employer association arena for about 14 years now. My role at the Progressive Contractors Association is working with many of our members across the country, but most distinctly here in Ontario, representing their views, particularly on the skills trades and other issues. But as childcare actually has a large effect on the skilled trades, so the construction industry is looking for labor. You hear the skilled trades shortage, and we are trying to attract women into the labor force. And so from that perspective, our contractors would love to fill their labor forces with women, but childcare is always the hurdle. So that's we come from that issue from that perspective, and we'll be happy to join the conversation with others and provide our unique voice from the construction industry.
Thank you so much, Karen. Appreciate your introduction as the parent first. And the labor force issues is something I do want to ask you about a little bit later on. But I'll carry on, introduce the rest of our panel. We have Julie Bisnath, and she is with the Childcare Providers Resource Network. This is a not-for-profit that's been around for about 40 years in Ottawa. I think I got that correct. Julie, could you tell us a little bit more about your organization, yourself, your work, just a brief introduction?
Sure. Thanks so much for having me. So I too come to this first as a mom, probably about 20 years ago when I started looking for childcare for my own 2 young children. And then more recently in my role at the Childcare Providers Resource Network. So yes, we are a nonprofit charitable organization, and we are celebrating our 40th year, located here in Ottawa. We are a grassroots organization built by volunteers passionate about high quality home childcare. So we support and empower, inform, educate through relationships with home childcare providers to attain that high quality home childcare that we all want. So yeah, we provide lots of good services to home childcare providers, parents, grandparents, anyone with little ones at home.
Great.
Thanks for having us.
Yeah, no, thank you for joining. Thanks for your time today. And the last panelist is someone I'll refer to as the other Andrea. We have Andrea Hannen here today, and she is representing the Association of Daycare Operators of Ontario. Andrea, welcome. Thank you for joining us. And perhaps you can give a brief introduction of yourself and your work and who you represent in the childcare arena.
Thanks, and thanks for having us here today. So the Association of Daycare Operators of Ontario, we're the industry association for independent licensed childcare programs, both commercial and not-for-profit. So our members include licensed childcare centers, home childcare agencies, Montessori schools, nursery schools, preschools, private schools with programs for children under the usual school age, and also school age programs. And our members are independent licensed centers, meaning they're not owned or operated by any form of government, any public sector agency. So they're not owned or operated by a municipality, they're not owned or operated by a school board, and they're not affiliated with any of the big national charitable organizations that are in the childcare space.
Okay, great. Thank you for laying out the groundwork on what all of you do. Open the discussion, I think, with a question that I think each one of you might have something to add on this, but does really seem at this point that we're heading in the direction of a national plan. Of course, we have Ontario, who hasn't signed on yet, Alberta and New Brunswick. But just broadly speaking then, how do you or your group feel about the advent of this national system? Andrea, can I start with you on that one?
Sure. We've had a good look at the agreements that the federal government has signed with provinces so far, and our big concern about those agreements are the number of families that are excluded in them. So those agreements really seem aimed at moving more and more of the licensed childcare sector into the public sector or the quasi-public sector space. So what we can see in that is reduced parental choice in the field of licensed childcare, but also what we see is that families who don't use licensed childcare are pretty much excluded from those agreements unless they're migrating their children into the licensed childcare system. And it's not just the licensed childcare system, it's a very narrow portion of the licensed childcare system. So certainly, we're concerned about parental choice with that. And also, here in Ontario, a very large percentage of families don't use licensed childcare at all. And, I guess I would argue that aren't those children worthy of support?
Yes, well, that's a good launching pad to ask Julie how she feels, as I think many of the people you represent are actually not licensed. So did you want to dive in there and comment just broadly about the move towards a national system?
Sure, I'll just echo everything basically that Andrea has said. We are also deeply concerned about families and providers who will be left behind, who are, seem to be currently excluded from the plan. So anyone not using licensed childcare, and then as she said, within licensed childcare, it seems to be a very narrow reach. So that's where we come from. We support all home childcare providers, but we do have a lot of unlicensed independent home childcare providers who we advocate, on their behalf, and we're concerned, they're concerned.
Yeah, so I want to talk with you a little bit later about why providers might choose not to get licensed, but I'll ask Karen if she wants to comment more broadly on the evolving politics of national daycare as it unfolds. Anything you want to add to what's already been said?
Sure. Well, thank you. Our organization doesn't necessarily have a formal, from a construction standpoint, have a formal policy position on the issue of childcare. Although we do have a formal position on the issue of attracting more skilled workers. And I think in my introduction, I mentioned there are many targeted groups that we're trying to attract to the workforce. And one of those groups is women, but it doesn't just have to be women. We're trying to attract additional people in many different communities to the workforce. But a large hurdle with construction is that construction, first of all, always works in temporary locations. You're never at a permanent location. So you need to have flexibility. You may be driving 2 hours, you may be driving 3 hours. Construction doesn't always start at 8 a.m. A lot of the times construction will start at 6 a.m. in the too. In some cases, depending if it's a large industrial construction project, it could be operating outside the city limits 24 hours a day in some cases. So your flexibility for childcare or the need for childcare could be in the evenings or it could be in the early mornings, but where you would not necessarily find what I would say your typical or licensed daycare facility and that flexibility that is offered typically in the marketplace. So a lot of parents will turn to a more flexible childcare solution. So our concern, to answer your question in a long, long way, our concern is more about flexibility for those workers that we're trying to attract into an industry that needs flexibility, and concern that the current proposal may not increase that flexibility.
Yeah, thank you, Karen. So I'm hearing a lot of moms and choice, and then I'm hearing about a reduction in choice. And I want to just flesh this out a little bit, because if I've heard it once, I've heard it 1,000 times, that the move towards this sort of system is an expansion of choice. But all of you have referred in various ways about a reduction in choice or decreased flexibility in Karen's case. Could we just explain really concretely why it might reduce parents' choices in childcare? Does anybody want to dive in on that?
Sure, yeah, I'm happy to dive in on that. If we look at, and I think I was glad to hear actually that Bev Smith is going to be one of your guests coming up, because Bev, in a future webinar, Bev has done some really great work tracking the evolution of some of the childcare systems that are considered models, so Sweden and Quebec. And one of the things that she has really pointed out is that the funded option that an area chooses, the funded option soon becomes the only financially viable option for families. So I think, you know, that's one side of the situation. So if we're only going to fund public sector or quasi-public sector licensed providers, that sector will grow and everything else will shrink. So right there is a limitation on choice. And I guess what I would say is we have a pretty good example of that in Ontario. You know, in the rollout of the full day kindergarten program, because don't forget, full day kindergarten, pre-kindergarten, junior and senior kindergarten used to be provided primarily by the independent licensed sector or the licensed childcare sector. And when the province of Ontario rolled out the full day kindergarten program, in the first 5 years, we saw over 1,000 licensed childcare centers close in that first 5 years of that rollout. And we didn't just lose the spaces that supposedly were replaced by the full day kindergarten program. We lost all of the spaces for all of the children in other age groups that those centers served. So it wasn't just, you know, a narrowing of choice for families whose children were 3.8 to 5 years of age. It was a narrowing of choice for a lot more.
Can I challenge you there, though, Andrea?
Sure.
You know, our opponents on this issue who love the movement towards a federal plan will say that the movement of children into full day kinder is because that's what parents really wanted. That's what they wanted. So they ran to the option that they truly wanted that wasn't accessible before. Anything you have to say on that, I guess, before I move on over to Julie for her comments?
Well, I guess what I would say is families, you know, how do you compete with free? Although free isn't free. Clearly, it's reflected in higher taxes and all that kind of thing. For families who weren't paying the full fee for licensed childcare before, so families who were in receipt of fee subsidy, you know, they didn't have a choice to migrate their children from independent licensed centers or whatever the childcare arrangements were before. If they were in receipt of fee subsidy, they were arbitrarily moved into the kindergarten program.
Right.
You know, so I'm not sure that it's what they wanted. It's what they were told they had to do if they wanted their subsidy.
Right. Subtle distinction there, or not so subtle. Julie, I know that you are representing some providers who choose not to be licensed, and this often in the parental framework can correlate with a lack that licensing is a quality lever. I wondered if you could comment from your perspective on why a home provider might choose not to be licensed.
Sure, and I just want to start, if it's okay, to by clarifying that for us, you know, when we say independent or unlicensed, it does not mean illegal. That those are two really different things, and that independent home child independent home childcare providers operate legal home childcare businesses. And for reasons as to why a provider might not want to join an agency, we've actually done a bit of research and we've talked to lots of different providers, and there are a few different reasons. I think firstly, independent providers, like, they want to be independent. They value that. They value being their own boss. They value being in complete control of their business. They're entrepreneurs. So there are some concerns about fees that agencies charge for providers to join. There's concerns around the fee that the agency is charging parents, and then, compared to what they're paying the provider. So there's a loss of income there. Concerns about too much administrative burden, too much red tape, micromanaging, lots of small, little policies that don't make sense, or some providers don't feel should apply to their particular situation, and the families too would agree with that. And there's a feeling that there just isn't a need. They do their own professional development. They follow the CCEYA regulations. They are up to date on pedagogy and early learning. They don't see an incentive. And even when, even when there were incentives, so agencies that offer a no fee model to join, or you can have a 6th child if you're affiliated with a licensed agency, we still don't see providers running to sign up. Even with those incentives, they don't want to be affiliated also with potentially an agency or a sector that previously maybe looked down on them, or didn't respect or value the work that they do.
Well, when I'm not researching childcare as a policy issue in front of my computer, I'm at the parks with my 2-year-old, and I know I ran into a provider recently, and she had been with an agency and then left. And one of the reasons I think why was she explained that the agency had regulations in COVID that she wasn't allowed to go to public parks. And I thought that was interesting because not as a policy analyst, but as a parent, I would choose the provider who was allowed to go to the parks. So that was kind of an interesting thing, a framework that the licensing agency is fully free to establish, but wouldn't be my choice, which as a parent, not as a policy analyst. So I thought that was interesting as well. I think we'll return a bit to the quality discussion, because whether unlicensed or licensed, that's another point that we're told that the public care is always better quality care. But I would like to get back to Karen a little bit on flexibility and choice for mothers and women working in your sector. I know you had a bit of a personal story there about wanting to work part-time, and perhaps you can tell that story yourself, but would have chosen to not work at all if you couldn't work part-time. Part-time care is very difficult. Could you tell that unheard voice a little bit of working in the industry, or with the industry that you do? Unmute your, can I unmute you?
Thank you. I've got it. Thank you.
Start again.
Yeah. Yeah. So let me be clear. I am not a skilled trades person. I try my best around the house on the weekends, but I am not. But I do work for an industry that I would say has high expectations on flexibility of hours of work and work situation. And what I did share with Andrea as we were talking about this forum is that I came back to the workforce after my first mat leave, and would have only returned if I had flexibility with a part-time role. And from that perspective, finding that flexibility of childcare that would meet the part-time role because of the hours of work and the travel that was demanded was very difficult. And I think if I was given the choice from that perspective, there's many moms that choose to come back to the workforce in a part-time role at first and find themselves to be part of the labor market in a full-time role in a few years later. And if that's what we're striving to do, I'm very concerned that any type of childcare proposal that just that is black and white, that assumes you work or you don't work at all, that doesn't provide for that flexibility decision making when your children are young would probably force many just to make the decision, no thanks, I'm out. And I would have been out if my decision was nothing or everything. I would have been out of the labor force. And the only reason that I'm still with it now, 9 years later, in a full-time role, and taking part in the labor force as the government wishes I would, is because I was given the flexibility to be able to find the childcare that worked, and then also, given my income level at that time, be able to take advantage of tax credits at that time to be able to assist me with the childcare costs. So that's my story, and I would say that's not unlike many, and I think everybody, you two that are working in the association world with childcare, probably not unlike many of the stories and many of the family situations that you see on a daily basis, especially coming out of COVID. And I don't think coming out from a COVID perspective that people are ready to go from an all or nothing again. And there needs to be that kind of vision of flexibility, and how do you incorporate that in a very boxed childcare perspective.
Yeah, I don't think we've really established at this point how the workforce is going to look post-COVID as we come out of this. But thank you for sharing that perspective. I mean, I'm struck as you speak by the challenges of childcare. What are women and mothers in your sector doing? What were they doing pre-COVID? What are they doing now? And we'll conclude our little discussion today with everybody chiming in on the solutions they see outside of national daycare type of settings. But I'm curious to know how women in your sector are dealing with childcare needs right now, Karen, which I could just say across the board right now, it's difficult to get, I think, part-time childcare. It's often a difficulty, and it becomes more difficult when the government gets involved, was sort of what I've learned over the years. But yeah, the flexibility you're looking for of changing job sites and shifting hours is really tricky. So do you know what women are doing, mothers are doing?
Well, I wouldn't say it's probably only women, it's men too in the sector, because I mean, anybody that works in the sector needs that type of flexibility, and whether their partner is going off to a different job and they're responsible for the childcare, whatever it may be. But very interestingly, at a Build Force seminar, Build Force is a national organization speaking about skilled trades and construction and doing some labor market analysis, approximately 5 years ago, maybe more, maybe 7, when a lot of the regulations changed for international caregivers to be able to come into the country. Made it much more difficult for international caregivers to come in. And one thing that was identified, particularly in Alberta, but also in Ontario to a certain extent, is that anybody working in high industrial construction like the oil sands, or even like Northern Ontario, the dependence on home daycares or nannies or whatever it may be is very, very high. So when those restrictions came in and made it much more difficult in order to find an individual international caregiver, those made it much more difficult for the construction industry. And it was identified that they were losing number of workers because there just wasn't the flexibility, and there just wasn't the absolute supply available for anybody to have that flexible childcare. And I imagine, I'm only taking a guess, but I'm imagining it's somewhat the same scenario for nurses that work, odd hours and odd shifts and overnight shifts, just like those working in heavy industrial construction. There's probably a lot of similarities there. So I'd say there are a lot of dependence on home daycare providers, as well as caregivers, nannies.
Yeah, and we know that kind of care choice isn't effectively supported as we move to a federal answer to our childcare needs here. I will remind everyone watching that if you do have questions, you can use the question and answer icon at the bottom of your screen there. Continuing to talk about childcare provision and quality of care, obviously parents are, if we could call this a point of agreement across any viewpoint, political viewpoint, everyone wants high quality care. So But again, if I have heard it once, I've heard it 1,000 times that public provision, not-for-profit provision, is identified as being the higher quality care. I wanted to just talk about that for a little bit. What does quality mean in these discussions, and what does it mean in the sector that you represent? So perhaps Andrea or Julie feel like chiming in on this one.
Sure, I'm happy to comment on that. I guess here in Ontario, I always shake my head when I hear the quality debate being framed as, public and not-for-profit care is somehow better than care that's available in independent licensed centers that are run as small businesses and so on. Here in Ontario, all licensed childcare providers have to follow the same rules and regulations. They're subject to the same inspection schedules. They're subject to the same licensing requirements by the Ministry of Education. And, that has been the case. It's been the case under the Childcare and Early Years Act, and that came in a few years back. But it was also the case under the Day Nurseries Act, which was in place for close to 50 years. So if we've all been regulated and licensed and inspected the same way for 50 years, what quality difference could there possibly be? And despite the fact that there are inequities in terms of funding support. I guess
Right.
the only part of the childcare space that isn't subject to those regulations is actually the public sector space in the form of the full day kindergarten program. It is not subject to the Childcare and Early Years Act. And if you look at the Education Act, there's very, very, very little information that is even comparable to the Childcare and Early Years Act in terms of rules and regulations.
And if I could just jump in there, I know that they'd be looking, I think, for some licensed providers in your sector to join their system. So does the quality magically emerge in the transfer if providers choose to join? Is that something that, the label bestows? I mean, I'm partially making a joke and being a little bit sarcastic, I guess, but truly they would be hoping your providers jump on over to the public system. Would they not? Is that not part of the plan for provision, is that your private operators should become part of the public system?
Well, I don't know how that could happen other than forcing the closure of their businesses and then hoping that they wanted to pursue careers in childcare and become employees of a public sector system. And, I don't really think you're going to entice too many entrepreneurs to become employees.
Right. Okay, Julie, quality in your association. Do you want to talk a little bit about that question?
Sure, thanks. Excuse me, I also have a bit of a cold. I hope it's not coming across through my voice, but
no, so far so good.
That for us, high quality has been our goal all along from the very beginning. And I think it's a shared goal, like you said, from all sectors. We know that quality exists across the board, no matter what sector that you find yourself in. And for us, high quality childcare goes beyond the minimum standards. It's a partnership based on mutual respect between the parents and the caregivers to create a safe and loving, enriching environment. It puts the care and well-being of the child in the center. And we know that these, sort of intimate relationships between the caregivers and families extend well beyond the childcare years. And in terms of quality indicators, we see things like, the personal referrals and recommendations, the families that are using the same childcare provider for multiple children, the intergenerational, like this sort of blew me away when I met childcare providers, independent home childcare providers who had looked after one generation and are now caring for those people's children. Like that seemed phenomenal to me when I heard that. We know that parents will pay holding fees to get a spot with an independent provider that they know and trust and respect. All of those things point towards quality. For us, I think I said it earlier, the independent providers who are doing their own professional development, who are participating in reflective practice, who are just, taking those measures because they want to, because they feel passionate, not because they're mandated to do so, not because they have to log so many hours or meet some sort of prescribed criteria. It's a labor of love. They do it, they love it, they believe in what they do, and they feel proud of their business, of their.
If I'm not mistaken, the home providers are also subject to the best ratios of adult to child. So least children per adult. Is that your understanding too?
Yes, so they follow the ratio set out in the CCEYA, which is 1 to 5 for an unlicensed provider, compared to potentially 1 to 6 if you're affiliated with a licensed agency.
Yeah, that's really, the quality, a quality discussion would be worth having across, just focusing on quality, because as I've looked at the research, it is poorly defined and involves a lot of circular sources, so people sourcing themselves, and the definition of quality is evolving. Our point of view at Cardus is always across the board that parents need to be intimately involved in how they choose childcare and decide what is quality for them. So a couple of questions have come in from people watching. I'm going to read these here off of our question and answer board. Would it be fair to say that the need for flexible work arrangements is greater than the need for non-parental childcare? Interesting. Is that something, Karen, that you can comment on? I'm not going to single anyone out. These are open to all panelists to comment on if you would like to.
I probably can't speak to that from an associational standpoint, from a professional standpoint. I can probably more from a personal standpoint, being a mom currently post-COVID or kind of during COVID. I think there is the ability. Many industries do have the ability for flexible work arrangements, and then many don't. And I think what we're seeing in media is, the story after story of people working from home in front of their, in their living room or in their basement or whatever it may be. That's not the instance in the construction industry. It's not the instance in healthcare, PSWs. We could probably, you probably have a long list, Andrea, of those industries that you not working from home. And so, sure, I would, maybe I'd suggest that there can be a lot of flexibility given within work schedules, but in some industries, it's just not possible. So the flexibility needs to be on the other side for the childcare. So I don't know if that answers the question 100%, but it's unfortunately, we see a lot of media insistence on parents working from home. And yes, that's the reality in some cases, but not obviously in our industry.
No, can't move the oil sands, hey? Anybody else want to jump in on that point of looking for flexible work versus the need for non-parental childcare?
I guess just on a related point is I would tell you that the regulatory system, certainly in Ontario, hasn't kept up with the need for flexible childcare, particularly in the licensed setting. So, we have a number of members who are focused on providing care for workers who are working non-traditional hours. So, EMTs, law enforcement, firefighters. There are some families who they require licensed childcare. They require licensed childcare in non-traditional hours. They need some level of flexibility because their work schedules change. And I find that the licensed childcare centers that are in that space tend to face a lot of challenges because the regulatory system really isn't set up to allow for that kind of care in centers. And so, and I think it may be something as simple as the regulatory framework hasn't kept pace with that, but also, that regulatory framework has to be staffed. And I think a lot of the public sector just doesn't want to work those hours. So, there tend to be a lot of challenges with that. And, certainly it is required if we're going to offer licensed childcare on this 24/7 clock for certain types of workers to make it easier for them. Government just hasn't kept up with that at all.
Interesting point. Not to put you on the spot, Julie, but you're welcome to jump in if you have an additional comment you want to make.
Sure. I just wanted to say that I guess, home childcare in particular has a history of being flexible and stepping up to respond to some of those needs, whether in Alberta, in the oil industry, or here in Ontario with healthcare or what have you. That we've spoken to many providers who have done extended day, early starts, accommodating families for any number of different reasons, travel, what have you, stepping up to almost be an extended support system in times of emergency or crisis, keeping children, into the dinner hour, evening, overnight, depending on, what the situation is. And that I think there is a need, that the workforce is not all 9 to 5. The industries are not running on a prescribed timetable. And while the unlicensed or independent home childcare sector has been working to accommodate that and to meet those needs, we definitely need to see a shift from both ends, whether it's more flexible work arrangements where possible, and then also more flexible childcare and more a greater range in choice and option for families.
Mm-hmm. Thank you, all of you, for that. Next question we have from people listening, watching. Childcare can be extremely expensive, making $10 a day attractive to parents. In view of your concerns about the program, what are some alternative ways to address the high cost of care? So fair enough. Yep, it is very expensive, and $10 a day sounds really good. Anyone want to jump in on that? That also does springboard into something we'll get into at the end, which is sort of positive solutions. If we don't like something, we ought to be offering or discussing solutions that actually work a bit better. So yeah, Andrea, you said sure, jump on in.
Yeah, so I think the $10 a day framework, there hasn't been a lot of discussion about that and what the realities are for instance, the Quebec model, which is often the model that's trotted out to say, oh yes, well they have $10 a day care, why can't we? And I guess I would just caution people that yes, we're all in favor of affordability. Yes, everybody would like to see parents paying less for childcare. Absolutely. It's very expensive. It's expensive to provide. But, I would say that these kind of blanket solutions of $10 a day daycare aren't terribly realistic when we're looking at a model that was developed for a province that's just a little over half the size of Ontario. So, would that model translate? Are we willing to make the quality compromises that would be required? Because certainly it's not going to be, oh, well, it's your usual childcare arrangement that you're used to having here in Ontario. You're just going to pay a lot less for it. No, it would have to be huge systemic changes where we change the number of teachers to children, where we change the group sizes, all of those types of things. And that's, those are the quality compromises that the Quebec model has had to make in order to provide that system. And, don't forget, they're not free of, labor disputes. They're in the process of having a labor dispute right now. They face some challenges with space creation. They've got, a wait list of 50,000 families right now. It's not the perfect model. So what I would suggest is probably looking to fund families rather than system. So don't be funding this great monolithic system that, requires families to change how they live in order to fit the funding model. Why don't we just fund families and let them pick the option that's going to work, option or combination of childcare options that are going to work for them.
Mm-hmm. Yeah, costs commentary there. Karen or Julie, anything to add to what Andrea said on the problematic nature of how expensive childcare can be for many parents? If not, then I'm going, oh, Julie, yes, no, maybe so.
No, just to echo along with all of those points.
Okay.
Yeah.
Yeah, I often, would love for parents and all of us to realize that the cost is an indicator of something, right? Childcare provision is very expensive. And the way that Quebec was able to drop the costs did involve a drop in quality, as well as Andrea spoke to that. I'm always referencing the fact that Quebec is the only province that has a ratio of 1 adult for 5 infants. So, we have to look for the parent of quintuplets who does not get any help to understand why that's not a great ratio. And then 1 adult for 8 toddlers. So these are ratios that don't exist elsewhere in Canada, which, it's funny. There's widespread agreement. If you love national daycare, people will still acknowledge that that is a bad quality ratio. Okay, questions are still open from people watching and listening, but I have my own here, and I think there's almost unlimited things in this area. I think part of the reason why we're having our Unheard Voices series is because the sort of ability to present diverse views has diminished over my time working on this issue. So I wondered if I could ask each one of you if you have a question that journalists are not asking about childcare policy and provision today. Is there something that you wish that journalists would investigate as they tackle the issue of childcare? And then the follow-up to that would be, what questions are decision makers not asking about childcare? But I'll start with that media storyline. Is there something you wish that journalists were unpacking more fully as they cover the issue of childcare?
I think I'll jump. Oh.
Karen, do you want to go first, and then we'll
Sure. Yeah. One thing that as I'm still reading and learning on this topic from a more global perspective than just our industry perspective, but I'd like to understand how a $10 a day childcare plan would affect our supply issues in Ontario. Because my understanding and my own experiences, we have supply issues, and I'm not quite sure how putting a threshold on price is actually going to affect the supply.
Interesting question. Andrea, you had wanted to add something, I think.
Sure, and it actually speaks somewhat to Karen's point, in that, I think what I would like to see is journalists, a couple of things. One is analyzing how much is actually spent of taxpayer money to support childcare systems versus how much support parents actually receive. Because, one of the things that we think about in terms of these federal provincial agreements is how much of that is actually going to fund governments or government systems as opposed to actually helping families. So, in Ontario here, and we're the only province that does this, we fund municipalities. So most of the taxpayer money that's allocated for licensed childcare actually funds it. It's allocated to municipalities who then have 7 different funding streams that they use, and very complicated formulas. And every one of the 47 or so municipalities has their own system for administering all of this funding. So it's very complicated. So what I would like journalists to do is follow the money. So are we getting good value for money? And are parents actually having choice? Are parents actually able to access these wonderful systems that are costing us so much money as taxpayers? I would like to see that, because, there's always worries when you fund families or consumers directly. Oh, what about waste and fraud? Well, you know what? Let's look at the numbers. Let's really drill down on that. Maybe we prefer a little waste and fraud. It would probably provide more people with care. You know, so I would, I guess I would just have journalists. I'd like to see them follow the money.
All the money. Julie, anything you would like to add there before we move on to questions that decision makers are not considering and ought to be, particularly I think on the provincial level. But yeah, any storylines that you think journalists could and or should cover as they address the childcare issue?
Those are both great questions, and for sure, follow the money and follow the numbers. For us in Ontario, you know, less than a quarter of children are in the licensed sector. You know, how does that play out for the rest of the children in Ontario? Like, where's the support? Where's the value? So follow the money, follow the numbers for sure. And for your second question, you know, when we think about decision makers and about funding childcare and what parents are doing and what choices they're making, we would like more research or more questions asked in terms of, you know, why are parents choosing independent home childcare? It's not because it's, you know, it's not because they don't have any other choice.
Yeah, surveys actually back that up. And
Yeah.
on a personal level, I had a baby roughly 2.5 years ago, and I wondered at that time, you know, what would choices in childcare be like for me, and would I be needing to change my policy positions based on my personal experience? And I'm pleased to report that as I was in moms groups, et cetera, most people talked about their choices in childcare. They did have them, at least in Ottawa. We know that varies a lot by jurisdiction and can change, but yeah, there was plenty of discussion of choices, and indeed I did have some choices in front of me. That didn't make it less hard though, I have to say. Like, leaving your baby with someone else is just not that fun, I can say, as a mom. Yeah, so the decision makers, is there anything else we want decision makers to be unpacking, uncovering, questions they need to be asking? I guess I'm thinking in particular, Ontario hasn't signed on yet, to the best of my knowledge, for a federal agreement. They're likely negotiating it right now. Billions of dollars on the table is very difficult to say no to. So under what circumstances, how do they sign on? What questions do they need to be asking? Yeah, the decision makers side of things. Any remarks there from Andrea or Karen?
Yeah, actually, you know, we're already seeing a chilling effect because licensed childcare owner operators, a lot of them have taken it upon themselves to have a look at agreements that have been signed in other provinces. They know that those agreements either exclude independent licensed centers. So these are centers owned and operated as small businesses. Most of them are women-owned small businesses. So those agreements either exclude centers like that, or they limit their ability to grow by saying that moving forward, system expansion will be primarily in the public and not-for-profit sector. So, you know, this is already having a chilling effect. Actually, just before this meeting, I was on the phone with a lady who has lovely, lovely center in Scarborough, and she has shelved plans for expansion to a second site because of the uncertainty of this, because she doesn't trust that her center is going to be included in any federal plan moving forward. And she says, you know, if they don't include me and I'm not allowed to expand, you know, what is the point in me being here? It's not even certain that my existing center will survive. So, you know, I guess I would just advise policymakers to think long and hard about what they're doing to the small business sector that's involved in licensed childcare. You know, how is it that this feminist budget would include women entrepreneurs who are, you know, most of independent licensed childcare centers are owned and operated by women. And it doesn't even have to be center-based care. You know, I think of all of the independent home-based caregivers. These ladies are no less entrepreneurs, and they would be excluded as well. So that's, that's very, very challenging. And I would just advise policymakers to think long and hard about that and about what it does to the supply issues and how is it that you can make policies that include these providers, both for the benefit of parents, but also to avoid sudden and dramatic shortages of care.
Right, which would reflect on the provinces likely, not the federal government as we move forward with this. Anything to add there, Karen, for decision makers in your sector specifically?
Yeah, I think particularly in Ontario, the provincial government introduced a tax credit, a smaller tax credit, but a tax credit for childcare in the past budget. And a lot of the conversation around this was that it provided flexibility for choices when they provided, and it wasn't a large tax credit and it was temporary, but it was providing flexibility for choices. And I have to give kudos to Minister Jill Dunlop at that time, who was the individual behind authoring this tax credit. Throughout many conversations, we talked about flexibility. So I think as Ontario enters their agreements, I think that they've already thought a little bit about this flexibility thing, thinking about the different industries that it serves, thinking about probably about what I would suggest the focus on certain types of careers right now and the value of them, such as PSWs, such as skilled trades, whatever it might be, and really understanding that a one size fits all approach doesn't fit. It doesn't fit for every family, and so I think from our industry standpoint, that's what we would suggest.
I'm fascinated. I think it's so interesting. It's definitely an unheard voice, untold story to talk about the possibility of supply diminishing as we move forward with national Canada-wide early learning plan, because certainly that would almost be the exact opposite of what we were told, and indeed why some voters would have voted for a national system. They would have thought because it increases the supply. My colleague Peter John Mitchell has calculated how many more spaces might come out of the agreements, and looking at the existing agreements, there will be extra spaces for 4% of kids, he calculates. So 4% at what cost? That's something decision makers can definitely turn their attention to. Just before I thank each one of you, we want to wrap up on time. If there's anything pressing you feel you want to share, last minute thoughts, unheard stories that you just have to get out there in the 3 minutes we have left, now is your big moment. Karen, Andrea, Julie, anything you would like to add? Hearing nothing, I will be happy to have us finish 2 minutes early. Again, we have our upcoming discussions of Unheard Voices with Helen Ward and Bev Smith, and hopefully Anita Turna, who is additionally supposed to be on this panel today, but had a death in the family, so wasn't able to come. We will be happy to continue this series and get the unheard voices out there as much as possible. For today, I'd like to thank everyone who joined us, and also a special thank you to Karen and Julie and Andrea. Thank you for providing your voice to this discussion today and for the work that you're doing. Yeah, we just thank you so much for being with us today. So we'll conclude our program and our presentation here with that, and look forward to seeing many of you for our upcoming Unheard Voices events. So thank you very much. I think we're not live, so thank you each. Oh, wait, I got muted.